Thank you very much indeed for the introductions, and it is absolutely wonderful to be able to speak with you all here today. It's my first connections with Indonesian colleagues, so hopefully there may be some really useful avenues for collaboration coming out of this. I will present some slides in a minute, which I put together quite quickly just before the start of the seminar. And I think that some of the research that I'm doing, which is mostly focused West Africa, a bit in South America as well, but mostly West Africa, I think the focus on innovation, appropriate innovation in a resource-poor setting, as well as the focuses on community health. I think there could be some really interesting synergies between what we have going on here at Southampton with our Ghanaian and Togo partners in Africa, with some of the work that's been presented here today. So let me just share my screen. Let's share and then... So hopefully you can now see my slides.
Great.
How's that for a minute? So there's my email address and Twitter account. If you use such things, by all means do get in touch, and I'm happy to share these slides. So please do ask if they will be useful. I'm based in the Clinical Informatics Research Unit. Our focus is on innovation in healthcare and research. I won't go into detail as to what these various groups are, but there's a lot of research governance, help with health policy, both in the high income setting, for example, across the UK Health Service, but also in resource poor areas as well, for example, including in Ghana and Brazil and Ethiopia. We've also got strong links with the Asian eHealth Information Network that my boss, Professor James Batchelor, is strongly connected with. So as I said, most of my research is focused on Ghana and Togo. I'm going to present a bit on some of the COVID-19 research and also a brief focus on my other area of interest, which is neglected tropical diseases. This is where we're talking in the world. So you can see in West Africa, just north of the equator, in Ghana and Togo. I'm going to focus on Ghana. The capital is Accra, down on the south coast. And we also have research going on in the rural area of Nkwanta. And this butterfly on the left, that's the Ghanaian flag. Now, we've been doing a lot of work looking at vaccine hesitancy and trying to support the vaccine rollout in Ghana. So as part of that, we've done some surveys, particularly with the general population. And you can see here some of the knowledge and attitudes around COVID-19. Most people have got the hang of it, that it's a severe illness transmitted between people. But there is also a fair amount of misinformation out there, often passed on via WhatsApp groups. I think perhaps like Indonesia, in Ghana, WhatsApp is probably the main communication method, the main electronic communication method. They don't use Twitter so much. They're quite big on Facebook, but I think the information around, for example, vaccines or COVID-19, good and bad, is transmitted a lot via WhatsApp. And this is our first report. We're going to update that in the next month or so around vaccine hesitancy in Ghana. It's open access on Figshare. And we've done 2 surveys so far. A third one is ongoing. In August last year, 62% of the population were willing to be vaccinated. When the vaccines arrived in Ghana, that went up to 82%. But we are concerned around particularly around the global north and our reporting around adverse events, particularly with the Oxford AstraZeneca vaccine, and whether that will undermine the vaccine rollout in the global south. We're currently having a bit of a look at that. These are some of the main predictors of vaccine hesitancy, gender being the main one, actually. Females far more likely to be hesitant than males. But also you can see this bottom point here, that people who received COVID-19 information, predominantly from family members or friends, were more likely to be hesitant. And again, that's predominantly transmitted via WhatsApp groups. And this is our ongoing survey. So from March, we had 82% willing to be vaccinated. So far, the survey's not complete, but there's a slight decrease in willingness to be vaccinated and therefore an increase in hesitancy. And we are, in the data we're collecting, exploring the reasons why. Can't present that to you yet, but in the next 2 or 3 weeks, we should have that information. So we can present that to the Ghana Health Service and to say that this is the kind of key sources of information and this is where the messages are being presented. One other area of innovation we're working on is, can we use mobile phone, self-reporting from mobile phones to detect outbreaks early? And this is using a platform that can use any mobile phones, not just a smartphone, any phone. Can it be used to detect outbreaks early? And it's also the sort of platform, this is a platform that's Ghanaian led and owned, by the way. It could also potentially be used to flag up other healthcare needs. So if there are other outbreaks of infectious diseases, if there is a famine or earthquake or flood, then again, a service like this potentially could alert national or district authorities that there is a community at great need. This is what the system looks like. Essentially, you dial a number free of charge, and then you get presented with a series of questions like this. So, are you coughing? Press 1 for yes or 2 for no. And then you answer just 4 or 5 questions, and that information gets passed on to the district health service. This is what the back end of the Opine World platform looks like. This is example data rather than real data. You can see the map. It tells you roughly where the person is located, and also some summary presentations of the questions that they've answered. So you as a district health officer can then look at that and decide if you need to go into any particular district or sub-district to investigate these reports. We're also going to look at long COVID in Ghana as well. We've got a data set of about 3,000 confirmed COVID-19 patients who attended a treatment centre. We're going to look at whether they have long COVID and also investigate levels of stigma, mental health and well-being as well. That will start in the next 2 or 3 months, hopefully next month. On neglected tropical diseases, so scabies and onchocerciasis are 2 of the bugs that I research. These are some pictures of scabies wounds. These ones on picture A and picture D are from the UK, actually. There's quite a few scabies outbreaks in care homes for the elderly. So they are patients in some of the care homes that we went into. It doesn't kill many people, but it is a very, very nasty infection. So you can imagine that these wounds being particularly itchy and unpleasant for the individual to have. We published a study we did a study in Ghana that was led by the Ghanaians and supported by Southampton. That's been published in 2020. And this is just one slide from it. We mapped where people were coming from and going to in terms of where they reported their skin infection. And essentially we found there was a lot of bypassing of their nearest health facility that generally went further away. And it's entirely possible that they would often go to Nkwanta, the main town, on market day. So it might be that they combined a visit to the market with reporting their skin infection, because many of the cases came from a long way away but ended up in Nkwanta District Hospital or one of the health centres in Nkwanta. So from that, we can start to get a picture together of healthcare seeking behaviour, sort of when and why and where people go to get their skin infections looked at. Bear in mind, it is a stigmatised condition. It might be that you want to go somewhere that's a bit easier to be anonymous and where people don't know you quite so well. So this is some good data to try and explore some of those thoughts a bit further. And that took place in Nkwanta in this part of Ghana. And onchocerciasis is transmitted by the black fly, and it's an unpleasant skin neglected tropical disease. So it causes this, and it's called leopard skin style presentation. And it also causes eye infections as well. Again, it doesn't really kill many people, but it is a very seriously unpleasant bug to get and to be infected by, and it does impact your quality of life. So I assume in Indonesia, you probably have mass drug administrations. I'm sure you do. They do in Ghana. The next mass drug administration, we're going to equip community volunteers with electronic devices of some kind. They currently use paper forms, and it's time consuming to fill out, and it makes real-time analysis impossible. It's usually 6 to 12 months later by the time those paper records are scrutinised. So we're going to test the feasibility of using the local community members who carry out the MDAs in their own area. We're going to give them devices, electronic tablets, and essentially see whether they can record data and whether that can be accessed and used in a timely manner, in particular during that ongoing MDA. Ghanaian colleagues are quite confident this is the way forward. Ghana does like digital health quite a lot. It is putting a lot of focus and resource in that area. But we're also thinking, can it be applied to public health emergencies? So we are also going to use this approach to gain data around vaccine hesitancy. So we're going to give devices to volunteers in rural and remote communities to gain insight into what those communities think about COVID-19 and about the COVID-19 vaccine. So that would give us valuable information from hard to reach areas as to whether they would be likely to take up the vaccine or not. So that is all I'm going to say. Hopefully I'm within my 10 minutes. But yeah, thank you very much indeed. Again, my email address is there if you wish for the slides. But I'm more than happy to continue these discussions. I think these are very, very exciting times. And I look forward to learning a lot from you all going forward. But for that, I shall hand back to our chair. And thank you very much for listening.
Thank you. Thank you so much. I think we learned a lot as well from the cases that you, or the studies that you did in Ghana, especially the long COVID. I think I don't think we have talked a lot about that in Indonesia. Whereas, you know, if you look at a lot of cases in the UK, in the US, people that got like mild symptoms from COVID, but they have like, you know, it's almost like the post. It's the PTSD, you know, the post, kind of like more like affecting their mental health, their well-being, their productivity. That's happening for quite a long time after they got COVID. So it's not necessarily just that when you're like getting like a really bad symptoms and you got like hospitalized for a lot of weeks, but you know, young people, productive age, they got long COVID as well, and something that's a lot of maybe that's just having to do with the way that we're still thinking of when you get COVID, then that's it. When you're recovered from it, you're not gonna get, you know, you're not gonna feel any other effect. Again, that's something that's really interesting. Also, the hesitancy. We, at least me, but talking to a lot of people, there's a lot of hesitancy as well in terms of like the vaccines. I don't know whether that is why our vaccination rate is not as high as other countries, but I think here it's more into the rural area rather than the urban one. I think in Ghanaian case, that's the other way around, right? It's the urban people that doesn't want to get vaccine. Am I right?
Yeah, although our survey is going to be a little bit biased because it was done via the internet, so it would require an internet connection to do the survey. So therefore, most of our population was urbanized. Hence why we're quite keen to do that second survey I refer to, where we're going to give community volunteers devices to go and collect further data from rural areas. That will hopefully kind of balance out our data a bit nicely so we can get a bit more insight into what rural populations are thinking. But yeah, I think hesitancy is going to be a problem. I think certainly anecdotal feedback from Ghana is that a lot of healthcare workers did not take up their offer of a first dose. So if the healthcare workers don't, particularly in rural areas, the community often looks to their local healthcare worker, who is highly respected in the community. So if the local healthcare worker doesn't get vaccinated, then the community probably won't either. So there are problems with information and misinformation, and we do need excellent health promotion across the world, but across, you know, urban to rural areas within places like Ghana. So it is going to be a key issue going forward, and it will be with us for, I think, alas, a long time to come yet.
Yeah, and I think across the social media platform as well, right? As you said, you know, WhatsApp is not only circulating good things, also circulating bad things. And and if you're not really well informed of what a vaccine is, it's gonna just increase the rate of hesitancy in the community. Thank you so much, Dr. Head, for the presentation, for the materials. Thank you so much.